What is a decreased libido? A decreased libido is where your sexual desires or your sexual interests are down. Okay? So, a lot of times when you just don't feel like having sex, that's called a decreased libido. So, people always say, oh, yeah, my libido is decreased. And they really don't know what it means, but it really is just simply a lack of interest, which means we all experience a decreased libido one time or another in our life, right? And it's okay because it shouldn't last too long. So we have some that are just short acting, short lasting, and then we have some that last for a long time. And that's when it becomes a concern, especially if it bothers you, right? That's or it bothers you, or it bothers your partner, or it bothers the relationship. So you do want to understand what is a decreased libido, decreased sexual interest. Just not really in the mood is not enough. It has to be something that lasts a little bit longer and really is affecting the relationship. For example, if I say, I just am not thinking about having sex, right? Because I have one issue, another problem, that is a decreased libido. But if you address the problem, it should go away, right? And that is the difference between just a decreased libido that is temporary, short lasting, versus something called hypoactive sexual desire disorder. And that's more serious, where there's absolutely no thinking, there's no feeling, no emotional feeling, and there's no receptiveness. So if somebody approaches you and touches you, it's like nothing, you don't feel anything. You're basically numb from inside out. And we don't want that feeling because it's going to be something that will be hard to treat. It lasts for 6 months, right? And it makes you miserable and you're wondering what's going on. So that's a little bit more serious, more in depth. I'm not referring to that right now. That when you have to see your doctor and get serious help, please. I'm talking about the ordinary, just losing interest. So it affects 1 in 5 men, younger guys, and 1 in 40 men, um, actually, the other way around. 1 in 40 men for the younger guys, and 1 in 5 men for the older guys over 40. So 40, about 1 in 20, and then 1 in 5 for guys that are younger, okay? Because it's a little bit more common. And a lot of that is probably anxiety and stress. Um, what does it feel like? Like I was saying, there's numbness of the brain and the body. It's like, I just don't feel anything. But it shouldn't be long lasting, right? Anything more than 6 months, get that checked out for HSDD. There's mentally just no thinking about sex, right? Physically, no reaction, right? So it's like, or reduced reaction. So it's not absolutely absent like an HSDD. But here it's more of, yeah, you touch and it's like, I don't really feel much. So you've got to be aware that is a decreased libido and it's interfering with your relationship and with your life, right? Um, Basically, there's no spark. You don't get that spark when he or she walks in the room. So there's a decreased libido. So I want you to really think about that. We all get it through different, times in our life, but you really have to pay attention to it to know to do something about it. Otherwise, you're just going to leave it there and just think it's normal. Okay. And that is not the same as being asexual. Asexual is an orientation, it's a sexual orientation. So you are asexual, meaning that's how you've been all your life. I'm really not interested in sex. In this case, it's something that you were, having great times, with sex earlier on in your life, and then suddenly something happens and you just lose interest and suddenly you go downwards and you're not thinking about it again, not feeling it, and not responding to your partner like you used to. So if you're having issues with your partner and it's like, I'm not getting turned on by your partner, then there's a decreased libido there, okay? Decreased desire, decreased sexual interest. And again, if it bothers you, please see someone like me, see your provider, see your therapist, and let them know so they can intervene. All right, what causes it, right? What is the reason for a decreased libido? Several reasons, as you can imagine. So I've got them listed here. And of course, the most significant one is psych, psychosocial, right? So when we're anxious, when we're stressed, I mean, that's the most common thing. We just shut down, okay? We just get turned off and we're like, I can't think of anything else but that stressor. And then when we get through the stressor, then we can actually think about other things, right? So sex tends to suffer when we're under stress. So you really want to make sure that you're addressing the stressors in your life that can cause anxiety, depression, right? Um, a lot of times this can happen throughout the ages or different years of your life, but the menopause and andropause, I call menopause when you go into the 50s and you stop having cycles for the women. For the men, you're also going to your 50s and your testosterone level comes down. You guys have to understand that that is something that happens normally to everybody when you reach that age. So when you reach that age, you're going to have some decrease in libido, but some people do not. Okay, so there could be an age-related factor in why you're having a decreased libido. Check that out with your doctor, okay? Fatigue, right? When we're tired, it's like, okay, I'm not interested, right? So you want to make sure you get some good sleep. You don't want to be tired all the time because when you get tired and more tired and more tired, you just turn off that libido and you just don't feel like having sex. So you want to make sure you get some good rest, right? Smoking. Smoking is going to decrease libido, and they say it does that by decreasing testosterone. Same thing with chronic diseases, diabetes, hypertension. They say they decrease the testosterone. Stress, anxiety, chronic diseases and ailments. Let's say you broke a bone, right? You're not going to really want to feel like having sex, right? So it somehow decreases your testosterone. Another interesting cause of decreased libido is being rejected by your partner over and over and over again. I know, guys, you are the ones that get that the most. I truly apologize, and I truly hope that you're able to understand it's not just you that's happening to, it's happening to a lot of guys, right? And you've got to learn how to handle it because rejection, to me, again, this is my humble opinion, is important for growth. When you get rejected, you get stronger. Whatever doesn't kill you makes you stronger. I truly believe that. So learn to adjust with a rejection and learn to come back so that you come back stronger for the next attempt, right? So ladies, please be aware. Several rejections, come on, we're going to take these guys down. And guys, be aware, several rejections to women will take women down too. Decrease the libido and affect the relationship, okay? Arguments, arguing, fighting. Now, some people will say that it increases testosterone, right? And then the guys want to have sex, make up sex, right? Women are a little bit different. We're more like, we just don't want to do make-up sex unless the younger ages, right? The younger, sometimes they just do that. But as you get older and you get more mature, it's not as easy for women because again, our levels are very small. Our testosterone levels are very small compared to yours. You've got big levels. So it's important to not argue. I'm someone that doesn't believe in arguing. You argue too much, it is, to me, a turnoff, okay? But of course, to each their own. Nagging, right? That can turn you off. Being too critical, too analytical, you guys that want this there and that there, or you ladies that want this there and that there, remember, it's a two-way street. Nagging will turn it off. Poor sleep, lack of sleep. If you're not sleeping, you're turning off your testosterone too. You make your hormones at night, about 2, 3 a.m. in the morning. If you're not sleeping, like now, you're going to have a decrease in your hormones. So check into it and see what's going on. If your levels are low, and if they are, get that addressed. Otherwise, make sure you get that sleep, good sleep. You're working too hard, you get too tired. If you work, you are lowering your testosterone and you're lowering your desire because you're putting work in front of your quality of life. And again, it's stressful and it causes a decrease in your testosterone and of course other hormones and other neurotransmitters and other chemicals that you need to have that desire. So you've got to get some good rest. And that reminds me, sleep apnea. If you're snoring, get checked for sleep apnea because that can make you not sleep and lower your testosterone guaranteed. Okay, so guys, gals, if you're snoring at night, get checked by your doctor for obstructive sleep apnea. Very serious, and it causes so many different ailments, including obesity. It causes not only sexual issues, blood pressure, diabetes, obesity, weight gain. It's horrible. So please get treated. It's a simple fix, very simple fix with the machine that you sleep at night with. And it's just for 4 hours. I tell my patients, just 4 hours, get 4 hours in, I'll be happy. And don't not do it. You've got to use it. Otherwise, you're not going to be awake the next day. You're going to continue to be tired, and it'll be a negative biofeedback, and you're going to just feel worse and worse as time goes on. So please get checked for sleep apnea if you're snoring. And if it's in the family, get checked too. It'll save your life now, guys, not later on, now, because when you take care of these problems now, they will not come and haunt you in the future. If you don't take care of them now, it's going to come back with a big bang in the future, and it's going to be harder to treat in the future. Okay, guys? So please, I love getting and diagnosing obstructive sleep apnea because I'm so happy that I can prevent your heart being affected and prevent your early death, because I tell you, the sleep apnea can cause damage to your heart, and it'll cause something called pulmonary hypertension, and then you're going to need an oxygen tank to breathe. I'm serious. That's how bad it can get. So if you're snoring, if you have a big neck, if they say that when you sleep at night that you pause breathing, or they have to wake you up, nudge you, come on, you're not breathing, go and get checked for sleep apnea. It will save your life. Medications can affect your desire, right? We know, especially the antidepressants, very commonly known, right? Not all, a lot of the antidepressants do that. A lot of the psych meds do that. Wellbutrin is the only one I know that really does not do that, can actually help. But ask your doctor, ask your psychiatrist, ask your psychologist whether they cause problems, and then get them evaluated by your doctor to see whether they can change them. Hopefully they can change them, okay? Birth control pills, big turnoff. A lot of women don't realize that, but the birth control pills with synthetic hormones can turn off your sex drive, so be aware. Let's see. Negative sexual experiences can lower your desire. Let's say you're in an argument and someone gets physical. You're not going to have that desire, right? Let's say that you are arguing so much, that can be a negative experience, right? You want to make sure that you're in a pleasant space, that you're being nice to each other, loving, and showing acts of, remember the 5 languages of love, showing acts of love so that you can actually stimulate the testosterone levels and the hormones that will make you have more desire, okay? Trauma, sexual assault, right? We know that's going to be a serious downer for your libido and decrease your sex drive. PTSD, very common, right, with the guys. And yet, I think it's common with everybody. I think some of us do get some trauma that's lasting, right, in our life, and it causes PTSD in one particular area. But hopefully that trauma can be resolved, and you can resolve the PTSD too. All right, so what can we do, and how do you find out whether it's something you can even treat, right? There is a questionnaire, okay? So I have that right here. It is called Decreased Sexual Desire Screener, okay? So I'm gonna zip through the questions real quick. In the past, was your level of sexual desire or interest good and satisfying to you? Was it great and good? All right, that's the first question. Second question, has there been a decrease in your level of sexual desire or interest? Third question, are you bothered by your decreased level of sexual desire or interest? Number 4, would you like your level of sexual desire or interest to increase? Number 5, please circle one of the following factors that may be affecting you and your sexual desire. A, an operation, depression, injuries, or other medical conditions. B, medications, drugs, alcohol that you're currently taking. C, pregnancy, recent childbirth, or menopausal symptoms. D, other sexual issues. You may be having some pain, decreased arousal, or decreased orgasms. E, your partner's sexual problems, right? That's a biggie, right? If your sex partner is not performing, that's going to lower your libido both ways, okay? F, dissatisfaction with your relationship or your partner. And G, fatigue. So if you take one of those questionnaires and you find that you have a decreased sex drive or decreased libido, please get help, because there is help and there are great answers for you, okay? And it's not, don't be ashamed, like I said, most of us will have the experience at least once in our life, okay? All right, so treatment would be definitely to address all those factors we just mentioned, and exercise, right? Exercise brings out those good hormones, those good pheromones, those good chemicals that make you feel nice and happy. And remember, working at work is not exercise. Walking in a factory and climbing stairs is not exercise. Lifting heavy boxes, it produces the bad chemicals. When I say bad, the stressful chemicals. I need the good exercise where you feel nice and fine and you go out there and you look at things and you feel good. So that's exercise. You got get out, or in the house, you exercise, but you're not under stress because you're producing cortisol when you're under stress. So you want to be eating well, exercising, stop smoking. I know that's hard. Stop the alcohol, stop the fighting, rest, get some sleep, get checked for sleep apnea. You can get some supplements that will boost your testosterone. There's some supplements on the market that will help your testosterone levels, or you can get evaluated for having the actual testosterone replaced. So it depends on your age, okay? What about some foods? Oysters, right? We all know about oysters, raw oysters. And they do say that it has some zinc that helps with the dopamine production and stuff like that. So go ahead and try that. Strawberries, avocado, they say they also have some nutrients and some minerals that actually help your sexual desire. So you can try that too. And some supplements, of course, your vitamins, vitamin C, very important to keep your body's functioning well, you know, in terms of your cells and in terms of your organs. You want them to be strong and not dying off, right? So you want them to be healthy. And I really want to say that the sexual desire of HSDD, which is the hypoactive sexual desire, which lasts for 6 months, and it's like there's this gloom, there's just no interest, no thinking, no feeling, and you don't, when they touch you, you recoil. That needs more serious intervention. And there are prescriptions like Vyleesi and Addy and some other prescriptions that we can use, right, to help the more serious desire issues. And one of them is an injection, okay? And it's pretty effective for men and women. Normally before menopause, you want to try the Vyleesi, but remember there's an injection for those that are very seriously having issues before menopause. So there are treatments out there, apart from what I just mentioned. And if you address anxiety, there are some herbs and some supplements you can take. I love L-theanine. It's amazing. You can get it over the counter. L-theanine is L-T-H-E-A-N-I-N-E. Great for anxiety, for guys and gals. Pick it up. Try it. Again, you know, it's based out of green tea. They concentrate it. It's just green tea. And there are other ones out there that you can try, but they're very, very effective when it's mild. When it's more severe, you're going to need more prescriptions. You got to see your doctor and try and get some prescriptions, which will not interfere with your sexual function, okay? But enough of that for me today. Wanted to give you some talk on that. See you tomorrow, maybe, or next week. And then we'll learn some more about sexual problems and solutions, okay?